I think the first thing that Congress needs to do is to stop viewing their job as being hyper-regulated for healthcare,
Sure.
tinkering with the machinery of the market. That always seems, even among Republicans, their default solution is, we need to restrict the activities of some private sector actor rather than freeing up the market, rather than increasing competition, rather than breaking the current regulatory paradigm. So I would love to see Congress just start to have a different type of debate, saying, how can we get more doctors to open independent practices in the United States, increase competition? How can we have more competition among service providers? How can we have more insurance products? I think a key problem right now, especially after the Affordable Care Act, is health insurance is so regulated, the ability to innovate new reimbursement models, new different types of coverage.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential. And here's your host, Jeff Crank.
Well, thanks for joining us for another episode of American Potential. Appreciate you being with us. We've done so many shows on healthcare because it affects so many people. It affects their lives with issues ranging from price transparency to inefficiencies in government programs, having a potentially negative impact on patients. And as complicated and burdensome as the healthcare system can be, what are some of the solutions to the issues facing healthcare today? Well, we have two guests today to talk about how to improve this system. Our first guest is Brian Blase, who's the president of Paragon Health Institute, and he's also the director of Paragon's Private Health Reform Initiative. He's held roles as a senior research fellow at the Galen Institute, a visiting fellow at the Foundation for Government Accountability, and CEO of Blase Policy Strategies. Brian also served as a special assistant to the president for economic policy at the White House's National Economic Council from 2017 to 2019. He's a regular contributor to publications like Forbes, Health Affairs, The Hill, New York Post, and the Wall Street Journal. Our second guest is Joe Grogan, a healthcare expert with over 2 decades of experience in the Washington, D.C. healthcare arena, now combining private sector and government roles. Currently, a senior fellow at the Leonard D. Schaefer Center for Health Policy and Economics at the University of Southern California, Joe's served various senior government positions, and his recent roles include domestic policy advisor to President Trump, overseeing the president's healthcare agenda, and associate director for health programs at the Office of Management and Budget. Gentlemen, welcome to the podcast. Thanks for being here.
Great.
Thanks for having us.
Now, how come when I was doing the introduction, I saw Joe kind of smirk when I was saying nice things about you, Brian? Why is that?
It's kind of an extensive bio that he gave you with all his achievements on there. That's my observation. He could shorten it.
Joe's also the chairman of Paragon's board, so it's always nice to hear the chairman of your board saying positive things about you.
It is. Well, as we've kind of been sitting here getting ready to do this, it's obvious you two are friends, right?
Yes.
And you've been in this battle quite a while. So
Yeah, I mean, we were colleagues at the White House, and Joe was there almost the entire, I guess you were there 3.5 years.
Yeah.
I was there 2.5 years. And when you work that closely with someone and you feel like, the whole world is against you, you develop really close friendships because you're like in the foxhole together. So we had that experience.
let's start with that because, in all these interviews, anytime I interview people who've gotten to work in the White House, I worked in Congress. I always thought it was so special to be able to do that. And so few people out of all of the millions of Americans, hundreds of millions of Americans, get to do something like that. Same is true for the White House, even more so, I think. Was that pretty cool? I mean, let's start with you.
Yeah, I mean, it really was. I mean, you think about when you're a little kid and what you want to do with your life, and you think, would you ever have the opportunity to drive into the White House gate every day, park your car and go to work? It was just a sort of a dream come true. And I had a blast every day going in there, working with great people, and you get filled with a great sense of patriotism being able to work there.
Yeah. Brian?
Yeah, I mean, really, it's a privilege of a lifetime to driving to work. And, I worked across the street in the executive office building, but it's a beautiful, ornate building. And we had our morning staff meetings in the West Wing. And just a privilege. Like Joe and I want to affect public policy for the better. And you get to be at sort of the pinnacle of the ability to shape policy in the direction, where we want to expand freedom and limited government, and to have access to the president, and be able to brief the president and the senior advisors to the president and really make a difference in changing public policy.
Right. Coolest thing you remember from your time at the White House? What's the coolest thing?
It's at the president signed an executive order in the fall of 2017 after the legislative health care efforts around Obamacare failed, and that kicked off 4 actions. And my main role was to successfully implement those actions. And the one that took the longest time, and which I think is long-term going to be the most impactful, it's this policy where employers, instead of selecting the plans for all of the workers at the firm, they can provide a contribution that's tax preferred, and the worker takes that contribution and buys a plan in the individual market that works best for them. I got to brief the president on that policy change on June 14th. I was a lead briefer. And then the president rolled it out in a rose garden ceremony. And I got to be in the front row. My parents and wife got to come.
That's cool.
And it was really, I have never felt after that day just such a profound degree of just satisfaction from, it took a long time, took a 2-year process.
Right. Lots
of meetings. And discussions and decisions, but to get that across the finish line and have the president roll it out in a rose garden ceremony that was the pinnacle for me.
Yeah, that's really cool. That's a great story. And again, how many people have anything close to that as a story, like in their professional career? That's amazing. Joe, how about you?
Yeah, when it's funny because when I started at the White House, I was also in the old executive office building, or the Eisenhower executive office building, and then I became domestic policy advisor. So my office was in the West Wing, and sometimes I'd be in the Oval Office 3 times a day, and the tempo of interactions just were far greater being that close to the president, traveling on Air Force One. As an experience, I'd say taking off on Marine One from the White House lawn is incomparable.
I would imagine,
because no one else can do that, right? Unless you're on the president's helicopter,
right.
You're never going to be able to do that. But there were a lot of great policy wins and announcements that we did in healthcare, and as domestic policy advisor, I was able to work on other ones too. Executive orders that he signed, great ceremonies that he presided over on improving America's mental health or organ transplant process improvements to speed the matching process to save lives. Just a tremendous tempo of great policies that we put into place.
Yeah. How about for just this one episode, we can call this the Joe Grogan podcast. Do you want to do that? Would that be okay?
I object.
Well, it might increase our ratings.
That's true. Yes.
You know what I'm saying? Anyway.
I have when I've gone into restaurants with reservations, and they look at me when I say this is Joe Grogan, and they with profound disappointment. Oh, we thought you said Rogan. We gave you the preferred table. We've got to find a new table for you.
That's funny. That's great. Okay, let's talk a little bit about Paragon Health Institute, Brian. Yeah. Tell us what you do.
So Paragon has been around a little over 2 years. And I think it's really important that we have a policy organization that is centrally focused on healthcare and entitlements, and looking at it from the perspective of patients should be in the driver's seat. We believe in free market, free enterprise, limited government principles, sort of the expanded choices for consumers. We need a competitive marketplace. And we need a regulatory climate that's conducive to innovation. And there's so many problems with government health programs, and really they advantage the incumbents over the entrepreneurs and the disruptors. So we are here to evaluate how government programs are actually working, not just the intentions behind the programs, and to make reforms that get the incentives right. Because right now, so many of the incentives are just for more spending, more sort of concentrated power, more decision making in Washington, and we need to get the incentives aligned so that consumers, patients, employers, providers are focused on how we can get value out of all of the spending that we do through the healthcare system.
So there's lots of things that can be done, right? And I think President Trump did many good things, right, in the area of healthcare. But there's lots of other things that Congress can do, and maybe I'll start with you, Joe. What do you think some of the things that Congress can do or the federal government can do to really help patients be more in control of their healthcare?
Right. I think the first thing that Congress needs to do is to stop viewing their job as being hyper regulators for healthcare and
Sure.
tinkering with the machinery of the market. That always seems, even among Republicans, their default solution is, we need to restrict the activities of some private sector actor rather than freeing up the market, rather than increasing competition, rather than breaking the current regulatory paradigm. So I would love to see Congress just start to have a different type of debate saying, how can we get more doctors to open independent practices in the United States, increase competition? How can we have more competition among service providers? How can we have more insurance products? I think a key problem right now, especially after the Affordable Care Act, is health insurance is so regulated, the ability to innovate new reimbursement models, new different types of coverage is profoundly restricted. So insurance companies have no way of coming up with new innovative products to keep people healthier and bring costs down. There was actually a fair amount of burgeoning innovation before the Affordable Care Act went into place, but it really shut a lot of innovative products and nascent innovation and reimbursement right down. So that is a big problem. We need more innovation on the reimbursement and coverage side. I'll give you an analogy on this. I spent a lot of my time in my career in the pharmaceutical and device industry on the innovation side. We spent a ton of time trying to figure out what are the policies that Congress can put in place to increase the number of drugs that are invented, devices are invented, and increase competition on that side. We've done none of that. Congress has done none of that on the insurance and reimbursement side. We don't have nearly enough innovation.
It's never good when government picks winners and losers in anything, right? Whether it's subsidies, energy policy, whatever. But it seems like in healthcare, government definitely puts its thumb on the scale, right? And I guess I'll start with you, Joe. I mean, that essentially, it seems like stifles innovation, stifles competition in the marketplace of healthcare when the federal government is doing that. Is that right?
Yeah, absolutely. And they, in whole sectors of healthcare, they set the rates and they set up a bureaucratic structure at Health and Human Services where government bureaucrats choose what to pay for certain services. I hate to use the analogy, but it's apt. I mean, it didn't work for the Soviet Union to set the price of wheat in the basement of the Politburo. It's not going to work for us to be setting prices for things with a bunch of bureaucrats. It's just not going to work. Now, we're not, because we're Americans, we are not going to become better central planners than the Soviets.
Right.
We're better innovators. We're better market leaders. We, because we believe in human potential and human creativity and individual merit and innovation. That's what America's strength is. It's not in central planning. And it's why you see this tremendous disparity of American innovation in certain sectors, but not an ability to control costs and improve outcomes in healthcare.
Right.
Yeah, and I think that's exactly right. And just to build on, the way that the Medicare system is set up, you have the bureaucracy determine what gets reimbursed and at what reimbursement rate. And I did a tweet this week, which was that Medicare, every single price that Medicare sets, and it sets prices throughout the entire healthcare sector, is wrong. And Medicare often is only looking at the cost. So when it sets the physician fee schedule, it looks at the inputs. It looks at the time and intensity, the resources that a physician's going to use to treat a patient. It doesn't look at the value at all. So it's totally missing a huge part of the equation. If you are a student of basic economics, the most important thing in economics is that prices need to be able to fluctuate to provide information and incentives about what's really valued. And when prices go up, right, that's a sign that we need to get more of that product, that product is providing value, and producers need to come in and figure out how to produce that product and do it more efficiently so that the price can come down. But you don't have those market signals in healthcare. And so much of the resource allocation is based on how much political power the different interest groups have. You have, Joe mentioned health insurers. Health insurers get more than half of their revenue now from the government. Humana is a major insurer in the country, and they dropped out of commercial insurance. They are only participating in Medicare and Medicaid because they can make so much money through the government programs. And these incumbent actors, they are doing really well from the status quo, and they try to limit the competition that they face. So it's just a huge obstacles, and it's not just at the federal level. You've got a lot of very perverse regulation at the state level that also restricts the ability of entrants and entrepreneurs to come in and disrupt the status quo and create these efficiencies that you get throughout basically every other sector of the economy.
Mm-hmm. We talk about, like you're mentioning, reimbursement rates, and I've heard from many people how the government will set like a Medicare reimbursement rate at a certain level, and then physicians say, well, I can't make any money doing that, so they just close off access to Medicare patients. I mean, that's a concern. And again, anytime government is just arbitrarily setting that, that's going to happen, right?
And one of the problems with the government price setting there is it pays more if services are delivered in hospitals than in doctors' offices. So you have the government policy creating incentives for doctors to sell their private practice and become employees of hospital systems. Okay. And consolidation in the healthcare sector has been it's a growing issue, and basically all the studies that look at it show it increases prices and generally doesn't do anything to improve quality, often is detrimental to the quality of care.
Yeah. And healthcare is complicated because the federal government's involved, the state is involved, you've got insurance regulations at the state. Joe, let me start with you on this one. There's lots of things Americans for Prosperity has been working on in the healthcare arena, whether it's eliminating certificate of need in states, scope of practice legislation. There's lots of things at the state level that can be done. Telehealth, that's a growing issue, for folks, which COVID, I think laid bare for all of us how important that was. What are some of let me ask you about those state reforms and how important those are for states to do it. But then also at the federal level, what are specifically some of the reforms you think that we can do?
Yeah, I mean, look, I think the certificate of need law issue is one even that some Democratic states have started to pick up based upon the leadership of people in the Stand Together network. And Brian's been very outspoken on the certificate of need laws, restricting competition. I think the key thing the federal government could do is if they started to rethink the current Affordable Care Act structure. I mean, we can talk about Medicare nonstop, and there are a number of reforms that we need to go to, but it would be very simple if we were to just say, okay, the Affordable Care Act was set up to make sure that everybody is going to get health care if they need it. That's the central point of the Affordable Care Act. But we are overpaying a bunch of insurance companies to provide coverage to people who don't need it. And then there are people that really do need coverage because they are sick and they can't afford the premiums, or they have to bankrupt themselves. They have to quit their jobs to earn less in order to qualify for enhanced subsidies in order to be able to afford the coverage. Because in some cases, the premiums and deductibles can be tens of thousands of dollars for a family to afford the Affordable Care Act coverage. So I think restructuring it to focus on people who are truly sick and could not get insurance coverage, say people with a child with a genetic disorder that's incredibly expensive to keep that child functional, or somebody with a very complicated disease, it's expensive. But if you're healthy, you should be able to buy a far more inexpensive product from a unsubsidized insurer out there. So Brian worked very hard at during the Trump administration to free up something called short-term limited duration insurance, which I know plenty of people who purchase. The Obama administration had really clamped down on it because it was competition for the Affordable Care Act. And we expanded it. It was a growing, successful product that people were choosing. The Biden administration came in and shut it down. So I think you need, if people want to keep their Obamacare, maybe they should be able to do so, but there should be other options for people who don't. And the focus of the federal government and the American taxpayer dollar should be on the truly needy to make sure that they get good health care coverage. And those people who can afford to pay it should be able to buy affordable products that fit their family's needs.
Right.
I'll give you three other policies for Congress. One would be to build on the price transparency rules that came out of the Trump administration. I think Americans know that they should be able to know prices in advance of receiving healthcare, and that's also something that's important for employers, since employers are such big purchasers of healthcare. Building on the price transparency rules, making sure that health plans, insurers, and hospitals are providing the price information in advance. The second would be to address the something called site-neutral payments. So I mentioned Medicare paying more for service, the same service if it's in a hospital system than in a doctor's office. That's just an unjustified cost for.
And that's just a regulation because they decided, they wanted to do it because the lobbyists got to them or what?
It's the hospital lobbyists are very powerful.
Right.
Yes. So to take on the hospitals, it's going to be politically challenging. But I think you have some bipartisan support. You have the sort of think tanks across the political spectrum aligned that site-neutral payment is a really common sense step and would reduce, one, unnecessary payments for taxpayers and beneficiaries, but also reduce the incentives for consolidation. The third is to address a major inequity that came with Obamacare, the Affordable Care Act's Medicaid expansion. So Medicaid is a welfare program historically for low-income kids, pregnant moms, people with disabilities, and low-income seniors. And what Obamacare did was expand it to able-bodied, working-age, mostly childless adults. But it created a much higher federal payment rate for the expansion population than for the traditional population. So actually, the first 3 years of the Medicaid expansion, the federal government paid the entire cost of the expansion population. It phased down, but it's at 90%, and it's supposed to be at 90% in perpetuity. The average reimbursement for these traditional populations is much lower. The federal government should
around
not be...
Around 50%. I'm sorry to interrupt you, but...
Around 60%.
60%.
Yeah. The federal government should not be discriminating against low-income kids, pregnant moms, and people with disabilities over and advantaging this Obamacare population. And you've seen studies now that show that states are taking resources from who the Medicaid program was intended for these low-income kids and people with disabilities, and spending them on this able-bodied population. And that discrimination should end. They should not, the federal payment rates that states receive should be equal for each of those groups. And I think, given there's got to be entitlement reform. I mean, we haven't talked about this yet, but the health care component of the federal budget is the one that is the most unsustainable, and where the trajectory needs to change in order to get the U.S. back on a sensible and sustainable budget course. And Medicaid reform is going to be part of that. And this, to me, is the most sensible, common sense way that conservatives should get on board with reforming healthcare entitlement programs.
Yeah. Let me give you an example of the transparency issues. You was talking about this. I was thinking about my own situation. I've got a torn meniscus in my knee. I went to the doctor. He says, I think your meniscus is torn, but before we do surgery, we have to do an MRI. And he sent me immediately, without any choice or anything else, to his MRI facility. I have no idea what that cost, right? Because I have no skin in the game, right? So wouldn't it be, that's such a great example of how if I knew and I had skin in the game and I had to pay a part of that, maybe it was $500 at his facility, but it was slightly cheaper at another one, I would choose the slightly cheaper. But if somebody else is paying for it, I mean, the convenience is it's right down at the next door. Of course, I'm going to go to the more expensive one, right?
Right, but sometimes you can get hit with a deductible for that service, and that you had no idea what your exposure was going to be, depending on the site of service. And it can be pretty variable. I mean, when you think about the complicated transactions that people make in their lives, buying a home, you sit there and you go through at closing. Why I'm paying this 6 months worth of taxes on this, and this is the mortgage, and this is going to be homeowners insurance. You think about buying a car. Okay, I've got the extra fancy rims. That's an extra $500 or whatever you go down. You can't really do that in healthcare, right?
Yeah.
You get these bills that are incomprehensible with codes that make absolutely no sense.
Right.
And then you ignore the bill the first, second, and third time because it's the first bill says you owe $40,000, and then finally it keeps on going down with each subsequent bill. And then sometimes you'll get another bill from somebody who was out of network and he did part of the procedure. But it's totally crazy that we don't have greater visibility into what we will be paying before we have a procedure.
Yeah.
And that, I think, is something that President Trump understood when we took him that policy and said, this is something we want to do. And the most vocal opponents of it have been the hospitals, who do not want to provide these prices to the patients in advance. And frankly, it's outrageous. We wouldn't tolerate this in any other sector of the economy.
Yeah.
A seller saying, we are not going to tell you how much we are charging you until after the fact.
Right. How about portability? I mean, that's a growing issue too. Health insurance has always been, it seems like, tied to your employer in America. And when that's a problem, like a pension. I look at the pensions, right? If you have a defined benefit pension plan, if you leave that job after 8 years, it doesn't go with you, right? But if you have a 401k plan, that 401k plan can go with you. Same thing could be true of healthcare, where we have this portability, and I leave one job and I can go choose it. Should we move in that direction, Joe?
Yeah, it's a really good question, and I think since so much of the that's regulated at the state law in the commercial market, I think you do need some reforms in that area. I'll give you an example, like why. Again, going back to my employee with a child who has a genetic condition that's very expensive to maintain. We are beginning to see new treatments for these conditions, very small population treatments that, because you can't, like for instance, Lipitor is a drug that many Americans take. The drug companies, it's not a cheap drug, but you make your money off a huge population. Some of these genetic treatments, you only know of 1,000 people, sometimes 500 people who have this genetic condition, 8,500, So you have to charge a lot in order to incentivize people to invent these things. If the employer's insurance company pays for that treatment, say $1.5 million, $500,000, that's a big hit, and then the employee moves on to the next. Because you want the insurance company to cover that treatment to get that child cured or improved, but you also you want them to benefit from that treatment, right? And the employee goes to another employer. They don't have to pay for the cost for somebody that just had the treatment 6 months before. So some type of high risk pool rider, I think, would be interesting to look at, that allows for portability for high cost treatments and would allow people to move a little bit more, and also strengthen the employer market. Because I happen to believe in employer-sponsored insurance. I think it's a nice big risk pool, and it is a bulwark against single payer. So I'd like to see some improvements in that regard to lubricate the market a little bit and allow for some degree of portability.
Yeah, so I mean, I think employer-sponsored insurance definitely has its advantages. But one of the problems is that it gives employers a lot of control over a worker's wages. Like the health insurance is not a gift from the employer. The health insurance comes from foregone worker wages, and there's no other financial product that we purchase that we give our employer the the way to structure our choices. And
Right.
a lot of workers only have a choice of one plan.
Right.
What we did, and the regulation I mentioned that President Trump announced, allows employers, and we actually call it the 401k of health insurance, where the employer provides the contribution and the tax treatment is the same. So workers don't pay any income or payroll taxes on the health insurance premium. So it's the same with this contribution. So the worker gets this contribution and then takes it to buy a plan that works best for them. Now, they can only currently buy plans in the ACA individual market. And as we think on how to propel this defined contribution health insurance model, it would be improving the plans that workers can use to purchase the coverage. What's nice about this model is it's voluntary. So if employers and employees like the traditional group plan structure, they can keep that. But if they want to migrate into sort of this new model where for the employer, it's really just a matter of figuring out what the contribution is going to be. They set the contribution for their workers, establish the budget, and then the workers can select the plan that works best for them.
Yeah. Okay. How about HSAs, health savings accounts? I was stunned. I have a health savings account. I love it. But I was stunned to find out that only 10% of Americans are even eligible for an HSA because you have to have the high deductible health plan. Should we extend that? Why would we not extend that to give more options to every American to be able to use an HSA?
Yeah, so it is, I think it's slightly more than 10% of Americans, but your point's well taken that it's not nearly as many Americans that have HSAs as should.
This wouldn't be the first time I'm wrong, by the way.
I was just reviewing a paper, Paragon paper, and I thought that we were about up to close to 40 million HSA accounts in the country,
Great.
and that there's over $100 billion of deposits in HSAs. Wow. But you flag the number one problem with policy in this area is that too few plans can be integrated with the HSA. So it's not just you need to have a certain deductible, you have to have other requirements on the plan in addition to that. And I think it's a very no-brainer to support policy that makes it easier for more Americans to benefit from HSAs. And actually, Paragon has a proposal that even goes further than that, because we don't like the way a lot of these government subsidies work, because they are, you're a beneficiary of a public program, but the check doesn't go to you to control. It goes to the insurance company, and the insurance company then uses that to reduce deductibles. So we think that people should have an option if they qualify for a government program and a government subsidy to take that subsidy under their control in a health savings account. So then they can choose the health care that best meets their needs instead of the government sending the check to the insurance company for the insurance company to control it.
Why is it that all Americans don't have access to HSA? Is it because Congress doesn't want to give the tax benefit for that and the reduced revenue? Is that the only reason?
Yes. So there's a budgetary effect with HSAs. HSA is a very good tax benefit.
Sure.
It's triple tax advantage, right? You don't pay tax on the deposit, the investment grows tax-free, and then you don't pay tax when you make a withdrawal for a healthcare expense. So there's some budgetary consequences. They wanted to pair it with the high deductible health plan because they thought that is a way, the high deductible is the way to get cost-conscious consumers. So you have the HSA available for individuals that have out-of-pocket exposure to healthcare.
Yeah, but it does seem like, we talk on this show a lot about government-imposed barriers to people, and that's a government-imposed barrier. The government isn't allowing you as an individual to have an HSA because you're on a particular plan, because it would reduce the tax revenue coming into the federal government.
I think we should, there is so much government spending on healthcare that doesn't produce value and that has bad incentives. HSAs produce good incentives,
Right.
because it's a person spending their own money,
Sure.
and they have an incentive to economize because the benefits roll over year to year.
Yeah.
So I am a big proponent of reducing government subsidies on just about everything else the government spends on healthcare. And if we're going to have a budgetary cost from expanding HSAs, then that's a much better budgetary cost. And you're right, it's a tax cut. It's not a spending increase.
Okay. All right, Joe. Congressman Sessions has a bill in Congress that does a lot of really good free market stuff.
Mm-hmm.
One, I don't know how familiar you are, probably very familiar with his legislation, but would love to hear your thoughts on that, as well as, what Congress can do. This is a big issue. Healthcare, it seems every year, immigration's a hot issue this year. Inflation's a hot issue this year. Healthcare is always a hot issue for voters as they go to the polls. How can we deal with that at the federal level, and talk a little bit about Sessions' bill?
Well, you're absolutely right. Every poll on healthcare captures Americans' discontent with the current system. Republicans, Democrats, conservatives, liberals, they're all upset with it costs too much, it's too complicated, it's very difficult to navigate going through the administrative hoops and the bureaucracy to get the care that you want. And it's just baffling to people. This whole conversation you just had about a health savings account it illustrates how badly we need that innovation to give people more control and have this not just the sense of control, but the reality of control over their own healthcare dollars and where they're going to go for their treatment. Sessions' bill is a great bill. It's a step in the right direction. It's geared towards giving more control. I think Brian's right. I think if Congress were to just do that Paragon proposal to move the subsidies from the insurance companies to the individuals in the form of health savings accounts, and then freed up a little bit of choices in the coverage market, we would go a long way to improving outcomes and controlling costs. Now, just think about that different paradigm shift. Congress, instead of saying, we need a new regulation on the insurance companies, or we need a new tax on this, or we need to spend more money, they're putting Americans in charge. They're freeing up the market. That would be the improvement. And the more members of Congress need to think that way. And I think Sessions' bill, it's not going to go anywhere right away, but it's an important step in the right direction that Republicans need to be coming up with these things, working it through the committee process. And there are Democrats now that are voicing concerns with the way the Affordable Care Act works for the first time. They were all in lockstep basically saying it was perfect, but they're admitting that some of the underlying provisions, the original provisions, have screwed up the incentive structure. And I think that there's going to be an opportunity at some point in the near future for bipartisan legislation to do some of these things.
Yeah, let me give you, I think, two heuristics for how to evaluate whether a policy change moves us in the right direction or the wrong direction. The first is who's got the financial control. And is it the government and the health insurance companies that have the financial control, or is it the consumer or the patient? So anything that moves us from financial control away from the government and insurers to the individual is a change in the right direction. The second is over price setting. Is the government, are we moving in the direction of the government have more control over what gets reimbursed and what the reimbursement rate is? Or are we allowing market forces to determine what gets reimbursed and what the reimbursement rate is? And anything that moves us away from centralized control in allocating resources, and that can obviously be barriers to entry in the marketplace too, is a step in the right direction. Because we've got to improve the demand side, which is empowering the consumers and giving them more control. And we've got to free the supply side from all of the government and the lobbyist preferences.
Yeah, right. Okay, thank you both for joining me. I appreciate it. Who won the big pickleball match this morning?
Brian lives in Florida and plays a lot of pickleball, so it's tough to take him on. He's somewhat of a ringer. I got taken advantage of.
Well, okay.
Next year.
Yeah, but you win the podcast name award, right? Like, the Brian Blase show
Blase is a good last name.
It's a good last name, but it's
so-
not as good as the Joe Grogan podcast. I mean, that's pretty classic, right? So anyway, thanks for joining us.
Thank
Appreciate
you.
Thank
both.
you.
Fun.
All right. Well, listen, this is an area we've talked so much about, healthcare and its impact on the American people. And I know of almost no other sector where we have so much government intrusion and intervention in the marketplace. And if we're going to make changes for the better, for people to have more choices, not less choices in healthcare, we've got to get the government more and more out of the business, as Brian said. So this was a great topic. Appreciate you joining us on this episode of American Potential. And as always, liberty and freedom are so precious. They're like your health. When you have health, you don't worry about it. Everything's great. But as soon as you have a threat to your health, it concerns you and you fight for that. Same thing is true with liberty and freedom. Fight for your liberty and freedom. Thanks for being with us.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.